Good morning, everybody. Today we are going to talk about subtle signs of autism in an older child. Now, sometimes a diagnosis of mild autism or Asperger syndrome is not made until a child is 5 years old or older, sometimes six, maybe sometimes even 6 or 7. I've even known kids that have had the diagnosis after 12 years old. These kids often develop the language in a normal manner, so autism usually isn't suspected. But as they get older and more social and development differences begin to show, then we realize that there might be something going on. Now, I'm going to talk about some of the characteristics that you might see in an older child. Now, don't be overly worried if some of these are familiar to you. Your child may display one or two of them. But if your child displays a lot of these symptoms, there is an area of concern there. Now, the first one I'm going to talk about is out of context language. Now, what is that? This is when the child answers questions and their responses are a bit out of context. For example, I might be evaluating a child in my office and I might ask them, "What is the name of your best friend at school?" The child may answer, "We saw a cat at school today." And then the mother may answer back, "No, honey, what is your best friend's name?" Then the child may answer correctly, Miriam or Fatima or whatever the child's name may be. But when also when I'm talking to a parent in my office and they have brought their child along, the child might be walking around saying random things like, "I like unicorns," "My daddy races cars," something like that. So this is what we mean by out of context language. Now, another one is unusual advanced language skills. Usually advanced language skills is very common in children with Asperger syndrome or high functioning autism. A child will be able to say his ABCs, one, two, threes, sing songs, recite nursery rhymes way before his peers. The child may also talk nonstop about something that he likes, something of interest, such as planets or different kinds of cars. A clue that this may be a concern is that the child won't converse on more general topics that a child should be interested in, such as football or, gaming or something like this. This can be confusing to both the parents and the doctor because it's hard to imagine that a child who is so intelligent could have autism. Now, I have seen parents come in and tell me how smart their 3-year-old is, how they can write and how they can read, and how that they can do math skills. They are smart. Don't get me wrong, they are very, very smart. But it is hard to convince the parents that there may be an underlying social developmental disorder. This is something, we need to look at. Now, answering a question with a question. It can be hard to realize that this is happening, but once it's pointed out to a parent, it becomes a lot more obvious. In my office, I might ask a child, "What did you do at school today?" And she may answer, "Did at school today? I played with trains, or I played with dolls, or I played with blocks." Or I might ask, "What is your favorite color?" The child may answer, "What is your favorite color?" Green, or pink, or blue, or whatever the child's favorite color may be. This is something to observe and to pay attention to. Now, Being consistent busy without checking in. What do I mean by this? Okay. I don't usually like to label any child hyperactive, but I do see kids in my office that bounce around the room, getting into things, banging walls, opening cabinets, and exploring just everything they see. It's not done in a crazy or a naughty sort of way. It's just in a very busy manner because that child just can't sit still. Some of these kids I know notice a subtle lack of interest or involvement of what is going around them and what is going on between me and their parents. Most kids, when I am in talking with their parents, they will come to see what is going on. These are typical children. They'll, ask, what are you talking about? What are you doing? When are we going home? Okay, so this is the way that a typical child may act. Okay, so most kids cooped up in an office will get antsy, but they should be cueing on about what is going around them. What are their parents talking about, especially if they're talking about them? They should be checking in, so to speak, and asking questions. And they should be engaging with me and their parents. But if they aren't, this is another area that we need to be concerned about. Missing social cues. A child on the autism spectrum does not pick up on social cues such as sarcasm, humor, teasing, or lying. He may understand and respond to what is being said around him, but he won't clue in on any underlying meaning that the speaker is trying to communicate through body language or tone of voice. Sarcasm is usually, jokes are usually big ones. They kind of go over their head. But as they get a little bit older, they start to understand them a little bit better. Now, lack of awareness of personal space, and this is really kind of a pretty big one. Because older children with autism or Asperger's don't understand social clues, they may tend to invade other people's personal space. Or he can be the complete opposite, unwilling to go near a stranger. Now, I have seen 4 or 5 year olds come right up to me and snuggle on me, but that's fine. That's great if that is something that the child is very happy to do, happy to see me and comfortable doing. But if this is something that they do every time they see different people, and this is something to be concerned about, it can be a warning sign. You may also see that your child likes to hug other kids or stand very close to them. So this is also something to be concerned about. Now, obsessive compulsive tendencies. These can occur in the young toddler age. They may not come apparent till later, but here are some of the typical OCD behaviors that I hear about from parents or that they complain about. Repetitively opening and closing of doors and slamming them. And maybe demanding that all the doors stay either opened or closed. Same thing with windows. Keeping food separate on a plate and getting upset if foods get mixed up, such as French fries and ketchup. It may cause a complete meltdown where the child actually refuses to eat. Obsessing over how items are arranged on a table or a desk. Wearing only certain clothes. Obsessively touching or lining up certain objects throughout a room. Now, the best thing you can do if you suspect that your infant or child has a delay in development is to see your pediatrician right away. a developmental pediatrician would actually be your best option. They can observe your child and advise you on whether you need to seek additional evaluation. Now, our next module will be Module 5, and this will be related disorders. So, thank you for joining us today, and I hope to see you in the next module.